what it is, and then we can be able to.
This meeting is being recorded.
Sure, I'll keep, just let me know when you're ready and I'll start.
Great. Thank you. Well, Zelerie, I almost just took what the next slide was. Report back. Is everyone back with us now?
I believe so.
Excellent. All right. Welcome back, everyone. We hope you were able to have a conversation with the others in your room, meet some new people. I had an opportunity, even a fellow county department that I didn't even know anything about. So you see how this happens? Great opportunities. So Zell, did you want to no? You want me to keep going? And she froze. Okay, you sound like a robot, so I'm gonna keep going. Okay, so what we're gonna do is we just wanted to hear from you if there is one person from each group that wants to do a quick report back. The two questions were, do you have any ideas about how this work might be furthered in Lancaster? And or you may have also talked about how do you see yourself or your agency fitting into the work. And so I don't know if you want to go, if people know what group number they were in, Tracy or Jarrell, I don't know, whichever way.
I don't remember what our group number was, but I can speak a little bit for our group. I know that we were lucky enough to have quite a variety of people in our group, including people that work at DCFS. And our group kind of turned the question around a little bit of like, what would DCFS want us to do in terms of the community? And really we got some really awesome responses. One is really taking a more compassionate and overall view on the families and the experiences that they're going through, and less judgmental. And I think that would make a difference on how we may be able to help these families. And then the other thing was really about just more community members joining these roundtables and really bringing their wisdom and expertise to that it could be something new to this particular family that maybe hadn't happened before. So and I think that's really what we focused around.
Excellent, thank you. And I should say I'm feverishly taking notes here, and it didn't dawn on me to ask anybody from my team if they would please take notes for me. So whoever wants to unmute from my team, if you just want to offer to take notes for me, then I can be a little bit more engaged in this and not having to look down. That would be.
And Lisa, Tracy, we are recording, so this will be placed on our channel, so you'll have that to refer back.
Great, I'm taking no more notes. Okay, excellent. Who else wants to share? Thank you so much for that, Sylvia.
We were in room number 5 and was there with Donna and Teresa and Iris, and our conversation focused on how to get to those most at risk to utilize the services to prevent the calls to DCFS. And that, incorporated components of staffing, that incorporated aspects of hopefully starting earlier. I'm with CareNet, so we're a pregnancy resource center. So we want to start as early as possible to develop those relationships, but still getting in the ones that are most at risk can be challenging. And we talked a little bit, Donna brought up the idea of being able to get them those $0 to $5 by looking more into mandatory kindergarten and things of that nature. So we could hopefully get them earlier, identify those at risk, and get them engaged and involved as quickly as possible is where our conversation primarily goes.
Thank you so much, Karen. My mind, of course, is already swimming and spinning as it always does. I know Teresa's on from Penny Lane, and trust me, as our prevention and aftercare agency. And just so everyone knows, what that means is when we receive a referral and we do not open up a case, we do not promote it to a case, one of our main So one of the things that we do in the majority of those referrals that we do not open up a case is that we refer them to Penny Lane for what we call P&A, or prevention and aftercare services. And it is a plethora of incredible services, either through Penny Lane or who Penny Lane contracts with, to ensure that children and families not only get services to address current issues, but to prevent exactly what you're saying, future system involvement. One of the areas that we're also looking at, Karen, is mandated reporter training and having deeper work within the community to understand what is reportable, what should be reported, and or explore are there other options that a mandated reporter, because oftentimes what you'll hear is, I'm not sure, something's not resonating with them, something is bothering them, but it may not rise to the level of an allegation of child abuse or neglect, but they know the family needs help and services. And so we want to be doing, and there is a lot of efforts and work, First 5 LA, obviously with Best Start, to be able to ensure that. And we also internally do, one of my other managers, she's not on this call today, she's on vacation, she spearheads our 0 to 5 work and our young children in care work. And so definitely, I've said this to a couple of you already on this call that were in my breakout group. Please note my email address at the end. And if you would send me an email and reach out to me, let's definitely have some further conversations about that. So thank you. Donna, obviously that goes for you as well. And there was someone else that you said was in that group, Karen. So thank you.
Iris, I believe. Yes.
Iris, wonderful. Any and all of you, write to me, please. Tracy will vouch that that's how we met. I just sent her an email and here we are. Okay, next, somebody else? And someone from the group I was in, Diana, Evelyn, does one of you want to share?
Lisa, I can go. I was in group 6. I wasn't in your group, but I can share a little bit about what we
Please,
discussed.
Gabby. Sure.
So our group really focused on education, really kind of like having meetings like this, really agencies taking on those conversations as well, within the teams, but as agencies as a whole, and really having those courageous conversations. Somebody mentioned, having those courageous conversations with yourselves as well, and how we're showing up to the work that we do, to, working with our teams, but also with the families that we serve. I offered the example of Penny Lane, has started racial justice training for all of its employees. So we're all divided into different cohorts, and we meet about 3 to 4 hours a month and really kind of take a deeper dive into these conversations. So it goes way beyond, our cultural sensitivity training, but really gets into conversations, on a much deeper level. So, being able to work in an environment like that, I think really brings a lot of these topics up, and it gives us a chance to work through some of these things so that we are very mindful in the work that we do with our clients. And as PFF, we're just trying to be really mindful how to include dads into the services, change our language, be very, very aware of how we are creating space for them, and making them feel welcome to, a very, maternal mental health, program, but also making space and room for dads as well, because they're a very important part of the work that we do. I don't know if anybody has anything else to share from my group that I missed. Yeah.
And while we wait, if anybody does, what I want to also mention is that there is a monthly Regional Community Alliance meeting. Yadira Sanchez, who's one of my CSAs or Children's Services Administrators on this call, she facilitates that every month. And what we've been talking about, Yadira and I, very recently also is really looking at possibly restructuring the format. Oftentimes it's a presentation by an agency that will share their service provision. But if there is a desire from all of you in the community to join that and have it also really lend itself to brainstorming sessions, those, really kind of work in action kind of meetings, that's something that really, I think would be an incredibly powerful community collaborative. Or collaborative kind of effort. So Yadira and I will continue to talk about that as well. Diana, go ahead.
Yeah, I was going to go ahead. We pretty well, education was our kind of focus too. Providing people with ways of getting beyond the problems that we're having, giving answers, not saying no, but here's how you might want to try to do it. And to let them look at some of the reasons behind some of the conflicts and things that are going on. And then we had someone from Doors come in, and I didn't really get a whole lot, don't understand who they are, but it sounded to me like it's a new group coming into the county. So we're going to be having some more help. And I didn't get really a lot of information from her about what the program was about. But I think education is a great big part, something we can send people to get answers, get the demonstrations, get a chance to change the way they look and think about things so they can handle their own problems and their own conflicts, and it doesn't raise into a big problem that ends up with DCFS being involved.
Thank you so much, Diana. And anyone else, just as we round this out, this is so great, everybody. Thank you so much for all of your suggestions and inputs. I can see Iris has a question.
Yeah, I wanted to share something. So being on the community advisory committee with the Lancaster Sheriff Station, something that I really want to work on is giving the deputies quick access to resources they can share with the community when they make contact with somebody. I'm just trying to think of an easy way to do it. And I was thinking of making like a PDF with local resources that they can open up really quick. Just in case they make contact with anyone who may be in need of anything, they can just look it up really quick and share the information. Because they make contact with so many people who are really oftentimes just in need of, resources.
Thank you for that. If you reach out to me afterwards, I'm going to connect you with somebody who is with DMH, and I am completely blank on the name of their program, but there is an app and it is so user-friendly, easy, and literally that deputy can just simply put in a zip code and a plethora of referral resources and referrals will show up. So I'm really blank on what it's called. Yadira, I don't know if you remember, and you can put it in the chat. And if not,
Is it One Stop?
And I'll add to you, Lisa,
Yeah.
as well.
1 degree, yeah.
1 degree. Thank you.
1 degree,
Yes,
yeah,
1
1
degree.
degree.
Also, another partnership we've got going on with DCFS, Shannon and Christine are working on a matrix, which we will be presenting soon, which what it does, it takes all that information you're asking for, Iris, and it's really going to concentrate it into one sheet, whatever, just in one area, so that everybody that is doing the similar type work or that needs access to this kind of information will be having that. So we are working on that and bringing that soon.
Excellent. And just so everybody knows, other people on the call, Shannon O'Brien is one of my assistant regional administrators, and Christine is with Best Start. Again, a connection that was formed from our partnership with Best Start. So excellent. That is
Lisa,
great.
I'm not sure if I saw Mary Loon take herself off mute before, so I think she wanted to make a comment.
Thank
Wonderful.
you. Yes. Hi. So my name is Mary Loon, and I actually work for the Department of Mental Health full-time during my day job, but I'm also a workaholic. So I created also my private practice own business. And I want to start getting into the groups, the collaborations with DCFS, how to get started with group mandates, because there's such a need out here in the AV, effective, really therapeutic groups. And I wrote a proposal recently to the City of Hope trying to get funding for this out here. And so I will wait and see if I get it, right? But in the meantime, I think there's such a need of the 0 to 5 for one groups, and even parenting groups of understanding their child with mental illness. Right now, it's such a need. Since the pandemic, we've seen an increase in a lot of mental health services for DCFS cases that are open cases, and also that just the community need. And so if we can also do if people that don't have the funding, right, or the money to pay for private mental health groups, I get calls all the time and I refer them back to myself at the Department of Mental Health. So I link them to us. So that's also a need, because there's we have 3 licensed clinicians in our program that strictly, if there's not an open DCF cases and it's open the prevention and aftercare services that you're talking about, Lisa, we can also provide the services to them for the families. And they don't even have to have Medi-Cal or insurance too even. So some of them don't have Medi-Cal, so they can still get services through us. But really, we want to, for my other part of my job that I do, kind of want to get into doing groups out here because there's such a need.
Lisa,
Excellent.
can I do a little plug?
I was just going to say, you might want to talk to, absolutely, Teresa, go ahead.
Okay, so we're starting to look at our July subcontracts, okay, because it's a fiscal year. And so I'm going to give you my email address if you're looking for funding. We have multiple subcontracts to bring services to families, all types of services to families in the Antelope Valley, okay? So my email is tculver@pennylane.org. Send me an email. I'll connect you with my program manager, Anthony, and we'll set up a time to meet and talk about how we might be able to work together for our next.
Sounds good. Thank you.
Okay.
Thank you. Teresa, put it in the chat for everybody as well. So that's excellent. That is excellent. Great. Thank you, Teresa. All right, I'm going to ask you just in the interest of best starts time, because, oh my gosh, we have really, really gone over, and I want to respect the fact that they have another agenda. Or
It's
important.
You're good to go. You are good to go.
Yeah.
I think this is such an important conversation that, you know, I don't want to like miss out on anything. So we're good.
Okay.
Let me just pull up your screen here, and then we did a report back.
We did the report back. And so the ask, which really I guess this is a little out of order, but we're asking that the community join us in partnership to help keep children and families safe. And I certainly hear all of your interest, desire, and commitment as well. And so I'm really encouraged by this, and I'm hopeful, and I'm confident that we will continue to have many, many more opportunities to partner together. So this is great. Next slide. And while there was a report back, we really wanted to just give an opportunity. If you have any questions or answers, or questions, we'll provide the answers, or maybe you have the answers, really to Zelerie or myself about what you heard, or just in general, DCFS related. The one caveat that I will say here, although I'm not sure of where everyone that has joined this call comes from, if there is any personal stories related to yourself or a family, this is not the forum. Please understand that we have a lot of mandates and laws with which we are bound. And so if anybody needs to reach out to me personally, they're certainly welcome to. I am going to show my contact information, and I always invite that, but just please make sure that in this setting, we don't talk about anyone's personal situation. That would be my ask. I hope you can understand that. So any questions for us? Okay, maybe not.
No,
All
Lisa,
right.
I don't have a question, but I do want to share in our work through Best Start with DCFS and your whole crew. I think one of the things that we're seeing is an advantage in terms of that we're able to then message to the community that that these partnerships are happening, that there's other work that's happening that maybe they're not aware of, that you know, DCFS has this horrific reputation, but that I think by us showing that the partnerships and by bringing this information to the community, I think it's also adding a part of humanizing DCFS, right? And I think that's really important. I think we've got to continue sharing this information, having these conversations with other members of the community as well. And I think that will make our work move forward for sure.
And I want to thank you for that, Sylvia, and thank you from the minute we met with you. That's been your commitment, is really to assist us and join with us in that journey. And trust me, it really, really means a lot. As I shared it a little earlier, it's not often that we meet someone from the community who says, you know, wow, we didn't really know some of this work, and we want to help shape and change the negative narrative that's out there. So I hope you can imagine how much that means to us. The way my slide, I'm going to call someone out here just to see, Miss Rita, since you're able to be on the call. Miss Rita Muhammad is our cultural broker extraordinaire, and she means so very, very much. And I just didn't know, as a community member, if you wanted to share anything about your experience as a cultural broker just before we end our presentation today. Not to put you
thank you. Thank you, Lisa, for inviting me into the conversation, and good morning, everyone. My experience as a cultural broker, as you know, I support both the family and DCSF. And it's been my intention to help the family know that DCSF is not the devil, right? I mean, they're here in your life because of some action that you took. So the intention then is to create a conversation with the family so that they are cooperative in their own case load, that they can come out on the other end of it with the desired outcome. So for example, if the children have been detained, your goal is to get your child back, right? But that's not always the goal. Some parents are like, they're better off without me. So what that looks like to me as a cultural broker is, okay, so let's talk about you. And my intention is always to find what is working in their mind for themselves. Excuse me. I try to help them see whatever is their most powerful, that whatever is their strength. And I take their perceived strength and we move forward from that perspective, if that makes sense. So for my contribution to the community as a cultural broker, and I've been doing it now since 2016, but I have to tell you that I have, since I have been participating in the ERDD roundtables, that my understanding of the work has been expanded. So we have to meet the families on all levels. So it's a multidimensional work. It's not just about the case content, but it's about the content of the individual. So I approach it from the perspective of a person-centered work. So I deal with the family collectively, and whatever individual in the family that I'm dealing with individually, I always try to make certain that we're clear about DCSF's requirement, we're clear about what the court is saying, and they don't always know the difference. They don't always understand that court mandated is not DCSF. So it's a multidimensional work, and as you can tell, I can talk about it forever, but my heart is with the healing of the family. That's my focus. And I can't do the work for them, but I try to meet them where they are and encourage them to do all they can for themselves. So, thank you.
Thank you so much. And thank you for joining us today in this presentation, because as I shared with you all earlier, she's not on the roundtable today. It was just important to us to have her join today. Okay, so Tracy, I think I'm not, could be my screen though. Oh, and there it is. I was going to say, so here is our contact information. You will note that we did not put phone numbers because we're not in the office very much. Just to let you know, obviously, we do a lot of our work virtually, and I am never without my phone right next to me, being able to see your emails come through. So please do not hesitate, and I encourage you to please reach out to us. Send me an email, send Zelerie an email, tell us a little bit about yourselves. Let's set up some future meetings. And really, again, I just want to really thank Tracy and Sylvia, Stephanie, Christine, Darrell. Your partnership means so incredibly much to us. We're so grateful, and it's still only been a short amount of time. So we're really looking forward, but thank you more importantly for believing in us and thinking that our work is worth presenting to your stakeholders and our shared stakeholders in the community. So I just really want to thank you for the opportunity, and thank you everyone for giving us the time.
Thank you so much, Lisa. It really, like you said, we met at a convening, so it's so kind of apropos that we're now here together again. Yeah, thank you so much. And it is, I think I can, really echo what people have been saying. It's so important to humanize the DCFS ladies and men that are working to really do the good for the families of the Antelope Valley. So thank you so much. If we can just, take a moment to thank, Lisa and her colleagues. So I will pass it back to Darrell.
Yes, again, thank you so much. So we're going to, before we go forward, I want to reiterate what Tracy said, because sometimes DCFS workers don't get enough acknowledgement for the heartfelt work that they do. And thank you for sharing. It's important that we get this kind of information to our partners and really support the work that you do. So thank you. So Tracy, we're going to move along. I'm going to share my screen and we're going to go to your PLA.
Yay!
Yay,
And I see a lot of familiar faces. Lisa's actually one of them. This is the Policy Leadership Academy. So we can go to the video. Basically what has happened is in the past 10 weeks, we started a journey together. We had about 30 people that signed up, and I think we're at, no, we need to go to the Policy Leadership Academy.
I'm going all the way down. All the way down.
And what happened is we really wanted to delve into policy. We wanted to really talk about what's going on in the AV. We wanted to really talk about how to come together. And so, if you want to just stop sharing, I can just share the screen on my end.
Okay.
There it is. Okay, there you go. And what happened is the Academy brought together the legislators here. We had a speaker, Tom Lackey. We had Congressman Mike Garcia. We had the city of Palmdale. And it was really a chance to delve deep into these discussions. And like I said, it was a 10-week course. It just ended. We actually had our last meeting on the 22nd, which was this week. And so we have a recap video for you, and I'd like to share that with you. And if you are interested in attending the next one, which is going to be starting on the 22nd, excuse me, on August 2022, we would love to have you sign up. And all of this information will be going out to you. And we already have about 25 people signed up. So it's pretty exciting. Like I shared with the group before, you can go to the next slide. What I shared with the people, the other way. What I shared with the people,
I'm in there.
It's okay, you'll get there. What I shared with the people before is that, for me, I have a background and I think policy sexy. I didn't think anybody else would, but people are really enjoying, the chance to delve deep. And so I'd like to share this video. If we could just make sure you have your share sound on, Darrell, so that we can make sure that people are hearing it. Okay. And then again, this is the recap of the Policy Leadership Academy video.
Okay. My share sound.
It's going to be on the 3 dots.
3 dots.
Share sound. And then good to go. And I'd also like to take an opportunity once more, those on this call that did attend, thank you again for your commitment.
I think there's a sense of urgency in trying to rally around and building an infrastructure that's dedicated to preserving and protecting the interests of children. I don't think that that's a partisan interest. I think that that's universal. And I think
Darrell,
that people's ideology.
Darrell, can you stop sharing real quick? I'm going to play it on my YouTube because I think there's something going on and it's lagging. So let me just pull it up real quick. I got it right here. Okay, I'm going to share my screen.
And building an infrastructure that's dedicated to preserving and protecting the interests of children. I don't think that that's a partisan interest. I think that that's universal. And I think that people's ideology often sometimes are impediments. And we need to get away from that. And we need to strike down those kinds of unrealistic barriers.
I had the pleasure of being part of the first cohort for the Policy Leadership Academy, and it has been an incredible experience. I'm so very happy that I not only heard about it, but had an opportunity to join and participate. I would say for me that the best part of it was the networking with other people in the community.
You all have a lot of knowledge and expertise around collaboration as well. And so the design for today is really meant to also tap into all of your knowledge and expertise so that we can learn from one another. You identified, right, that we're working towards a common purpose that it isn't just, although this is important, it isn't just about sharing information. That's valuable. But if that's the endpoint, then that collaboration from my frame of reference is not going to achieve the kind of social change that I believe is really important for us to live in a world that is good for children, families, and communities.
To be principle-based in my decision-making, to make sure I'm doing what's right for the country. I believe in the Constitution, I believe in capitalism, I believe in competition, and I believe in charity.
I know there's a passion, you can feel it, right? There's a passion in our community.
I love it.
Yep. We want to see things happen.
The most important thing I learned from the academy was about the different elements to a successful public policy advocacy. I really learned the significance of knowledge on public administration, learning to hear best practices from these experts and public leaders as they serve the community.
It really has become a program that is embraced by the community because it's from the community to the community, right? We have been able to provide food from day one of the pandemic and have not stopped since then.
It's a sense of belonging, right? I think all of us as individuals, right? And then we make a community, and then as a whole, as a community, we want to feel we belong.
Children's Bureau of Southern California, and the work that is being done in these courses has really been thrilling. Let's talk about challenging situations and challenging people. Use your language, use your words, cue in, schedule boundaries, engage, and above all, listen. Listen to what's being said, listen to what's not being said. It's all important.
And I would say a key takeaway after joining this Policy Leadership Academy is being yourself, learning to walk in the passion that was given to you. I've noticed that there's a strong sense of passion for all the agencies that come together to make sure that we are providing the most caring, loving, educational, financial resolution to our families that are struggling in the Antelope Valley. I've learned so much. I've learned so much about community, what it takes to be a leader.
Ethics in what context, ethical according to whom, at what time, and under what circumstances. At the end of the day, only you will know whether you have acted ethically based upon that own individual internal standard.
We're going to go to the next slide and talk about the world as it is and the world as it should be. In community organizing, we believe that we need to start with universal values. And those universal values are values that exist regardless of, where you grew up, right? What country, what, religion, what political orientation you have. Yes, okay, this is what makes me happy as a facilitator. Like, okay, you got it.
Yes, we got it.
You know what? The most important thing was that we got to get up close and personal with some experts that we may or may not be able to afford to pay for, if on a personal level. The other things were you had some really, really good professionals. Danielle Johnson, diversity, equity, and inclusion part. Miss Melody Tao, the marketing person, and then communicating with difficult people. We do that every day. That's helpful. So what I really appreciated was that you put together some things that helped me not only in my job with the senator, but also in my nonprofit.
If you're really using it to build up your presence and build up your brand, you want to have some sort of consistent schedule, and once a week is a great opportunity to start. Okay, it doesn't have to be every single day. Anytime you have a large following, it does give you credibility. It does let people know, hey, people are listening to that person and she has something to say. But keep in mind, that's not as important of having as having engaged followers.
And the work that you're doing and what you're engaged in, do you practice equality or are you practicing equity work? Maybe the people you're serving don't want to talk to you because you're coming in too hard. You're coming in a little strong, right? You're preaching to someone that has worked all day and now they kind of come sit and listen to you, right? And you're not being empathetic. So how are we showing up, right? Are you showing up with the appropriate, graceful, gracious attitude to connect with those that need support?
Just being in awe of the guest speakers that poured into us their knowledge and their experience and their life work. That's it, their life work. We just had our last speaker, which was mind-blowing. Can't even say anything less. Mind-blowing was Dolores Fuerte. And this civic leader just was amazing.
Is that we have to remember that we are one human race. And we should never use the word race unless it's attached to the word human. Together, human race. Again, we can see that we're not focused on education. And of course, education is the most basic thing that we need. It's the foundation of our democracy. Who's got the power?
We got the power.
What kind of power?
People power.
And again, that was our Policy Leadership Academy. And again, we do have our next one starting August 2022. So if that is of an interest to you, I urge you to sign up. For me, it was exciting too, because they were all new speakers to me. But again, delving into policy and really taking a look at what's happening in the AV on that level, really exciting. So again, if you're interested, we'll be sending you out the link to sign up, and I send it back to Darrell.
All right, I'm going to share my screen with you and pull up our slide. Our flyers for our next things that are coming up. We have our child abuse prevention speaker series that will be coming up soon. And if you have not received a flyer, they are going out. This will be taking place in the month of April. We also have our financial literacy workshop group that will be taking place in April. And and then the flyers for these will be sent out as well. Okay, and then we have our engaging in our diversity and inclusion that will be sent out to you as well. And we had some very positive feedback for that one. It has been such a pleasure working with Danielle. I do want to go back with our literacy flyer. If you received that, those will be done on a Thursday and a Saturday, a Tuesday and a Saturday. I mean, the Saturday meetings will be for children, so they will be addressing literacy for your children as well. Okay. And I believe that will be it for today. We want to thank you for coming. I'm going to stop sharing my screen. We thank you for coming. Also, you could be any place else, but you chose to be with us today. Thank you again for Lisa Crow and her staff coming to share with us. We really enjoyed and got a lot of in-depth information that we can utilize with our community.
And we will share with everybody. We will email out everybody any information that was given on here, any contact. We will make sure that everybody gets that.
All right. Thank you for coming.
Thank you.
And have a wonderful day, everyone.
Thank you very much.
Thank you, Ms. Mohammed, Ms. Rita.
And Stephanie can probably stop.